Violent attacks, overcrowding, and dysfunctional staff. For the Hawaii State Hospital, the heat is on. Months into a Senate investigation, lawmakers are preparing to tour the facility tomorrow. KITV4's Laura Yamada sat down with the state's health director to highlight the problems and the drive towards solutions.
I consider it to be one of the biggest challenges for the department right now.
Newly minted Health Director Dr. Linda Rosen says from day one she knew the Hawaii State Hospital had a bullseye on it. KITV4 has interviewed several Hawaii State Hospital staffers who say they were attacked by patients.
I got injured by him hitting me in the head, slamming me on the wall.
Something has to be done because we're going to have a death.
The full Senate investigation that followed triggered more outcry. Dr. Rosen says years of overcrowding, underfunding, and discrepancies in staff training have exposed a system in desperate need of help.
The patients keep coming from the courts, and there's really only one place for them to go, which is to us.
You see more patients that are also young and violent, making the situation just far too dangerous.
Senator Josh Green says an increasingly violent, drug-soaked mental health population has further crippled the state hospital, originally created for a more moderate patient base. And despite what's recently come to light, he says lawmakers failed to pass what he calls critical funding to expand the hospital and build a separate space for more violent patients.
Change isn't going to happen fast enough.
Rosen says they're planning to retrain staff, practicing mock scenarios and de-escalating situations, adding more protective equipment, including barriers in vans and possibly handheld ones. They're also pinpointing specific times during the day when patients tend to be more violent to then staff accordingly.
I think that this investigation and this tour and what have you is really shining a lot of light on what our needs are in society.
Laura Yamada, KITV4 News.
And Dr. Rosen says they do have the funding to create a master plan, eventually reorganizing and renovating the state hospital. Senator Green says tomorrow's tour will focus on talking with staff and figuring out ways to improve the system.